everybody, it is Erin from Choice Physical Therapy, and I'm going to be talking to you about the number one knee pain diagnosis that doctors see and physical therapists see in an active population. That is Patellofemoral pain syndrome, Pfps. So patellofemoral pain syndrome is basically a lot of pressure around the anterior knee or the front of the kneecap and where that patella sits. There are several reasons for why this happens. It is most commonly in an active population, running, people who do a lot of squatting, stairs, or jogging. And really what it comes down to is basically two things, either a misalignment of this patella in the tract that it belongs in, or a muscle imbalance above or below. So one thing I wanted to talk about that we see first is sometimes a misalignment. So your patella, I always show with my knuckles, glides between the two femoral condyles of your long bone, your femur. That patella is impacted by the muscles that sort of attach to it, your quadriceps. Sometimes, whether it's genetics or females, because of our body position, we can have stronger muscles that pull either way. It's almost like the reins on a horse, so you want to think about that. Also, that positioning or that tracking can wear down the cartilage surface underneath it, creating that inflammation and pain. The second thing is muscle imbalance. So we, as physical therapists, we know that the knee is stuck between two very mobile joints, your hip and your ankle. So if the knee doesn't move as much because it's a hinge joint and it's between two very mobile joints, a lot of that stress, if everything's not going well, happens right here at the knee. So as a physical therapist, sometimes we would assess the pelvis height. So Joe, I'll have you just hop down. And we would want to see, is one side higher? Is it a little bit more rotated forward or backwards? And that'll give us an idea, or sometimes even they can be rotated in or out. So we would take a peek at how the level is of that person to see how that might be affecting the knee. You can come back up. Once we find if there is any asymmetry in the pelvis or hips, we know how to use muscle energy techniques, strengthening techniques to sort of realign it so that the pressures and tension on that patella can be more neutral so that you're not getting one overactive sort of pull. So really the patella can, even though it's a small bone and a small joint, the patellofemoral joint, sometimes it can really cause a lot of pain in those running activities. So consult your healthcare provider, see sort of what might be causing your anterior knee pain. And if it is something that is mechanical or due to a muscle imbalance, we can certainly help. Hope that helps for any of your knee pain, and we'll talk to you next time.